হ্যালো বন্ধুরা, আজকের ভিডিও JEPBN 2021 পার্ট বি এর 72 to 100 কোশ্চেন নিয়ে। তাহলে চলুন দেখা যাক আজকের ফার্স্ট কোশ্চেন নাম্বার 72। মোস্ট কমন কজ অফ ম্যাটার্নাল মর্টালিটি ইন ইন্ডিয়া। অপশান এ ইনফেকশন, অপশান বি হেমারেজ, অপশান সি হাইপারটেনশন, অপশান ডি থ্রোম্বোসিস। সো মোস্ট কমন কজ অফ ম্যাটার্নাল মর্টালিটি ইন ইন্ডিয়া ইজ হেমারেজ। Question number 73. Which of the following is most specific of psychosis? Option A pressure of speech, option B neologism, option C incoherence, option D perseveration. So question number 73 correct answer holo neologism. Question number 74. Who collaborates directly with the client to establish and implement a plan of care? Option A primary nurse, option B nurse clinicians, option C clinical specialist, option D nurse coordinator. Question number 74 এর right answer হলো option A primary nurse. Question number 75. Which among the following is not a complication of twin pregnancy? Option A low birth weight, option B post maturity, option C abortion, option D chromosomal abnormality. So question number 75 এর correct answer হলো option B post maturity. Question number 76. Neural tube defect can be prevented by administering option A prenatal folic acid, option B antenatal phenobarbital, option C postnatal folic acid therapy, option D none of the above. Question number 76 এর correct answer হলো prenatal folic acid. Question number 77. The prognosis for patients with shock depends on the following factors except option A the type of shock, option B the cause of shock, option C the length of the shock state, option D pre-existing patient factors. Question number 77 এর correct answer হলো option B the cause of shock. Question number 78. Following are the nursing intervention for the patient at risk for injury from low red blood cell count except option A avoid prolonged tourniquet use, option B elevate the patient's head on pillows for shortness of breath, option C allow for rest between periods of activity, option D provide extra blankets if the patient feels too cool. So question number 78 এর correct answer হলো option A avoid prolonged tourniquet use. Question number 79. Which of the following developmental milestones is expected from a 2-year-old child? Option A use a spoon to eat, uses a cup to drink, uses a knife for cutting food, option D pour milk into a cup. Question number 79 এর correct answer হলো option B. Question number 80. Highest diameter of fetus skull is a mentovertical diameter, option B submentovertical, option C suboccipitobregmatic, option D submentobregmatic. So highest diameter of the fetus skull is mentovertical, that is 14 cm. Question number 81. Most common side effect of IUCD use is A ectopic pregnancy, B uterine rupture, C excessive menstrual flow, D expulsion of IUCD. So most common side effect of IUCD use is excessive menstrual flow. Question number 82. As defined by Freud, the ego is that part of the mind that contains option A the basic instinct and urges, option B the conscience, option C the ability to respond to the realities of everyday life, and option D all elements of the holistic person. So এখানে question number 82 এর right answer হবে option C. Question number 85. Question number 83. Tetralogy of Fallot is characterized by option A pulmonary stenosis, VSD, overriding of aorta, right ventricular hypertrophy, option B ASD, VSD, overriding of aorta, right ventricular hypertrophy, option C pulmonary stenosis, VSD, overriding of aorta, left ventricular hypertrophy, option D pulmonary stenosis, VSD, ASD, overriding of aorta. So question number 83 correct answer হলো option A Question number 84. Which of the following statements about chest X-ray is false? Option A. Before the procedure, the patient should remove all jewelry, metallic objects and buttons above the waist. Option B. A signed consent is not required. Option C. Eating, drinking and medications are allowed before this test. Option D. No contraindications exist for this test. So question number 84 এর correct answer হলো option D. Question number 85. Psychosocial theory is propounded by option A. Sigmund Freud, option B. Erik Erikson, option C. Jean Piaget, option D. None of these. So psychosocial theory is propounded by Erik Erikson. Sigmund Freud theory হচ্ছে psychosexual theory আর cognitive theory হচ্ছে Jean Piaget theory. Mid-day meal program was started in India. Option A 1961, option B 1981, option C 1991, option D 2001. So mid-day meal program was started in India in 1961. Question number 87. The umbilical cord contains following blood vessels: A. 2 arteries 1 vein, B. 1 artery and 1 vein, C. 2 veins 1 artery, D. 2 veins only. So umbilical cord contains 2 arteries 1 vein, that is ABHA. 88. Living standard of people is best assessed by A. IMR, B. MMR, C. Physical quality of life index, D. Death rate. So living standard of people is best assessed by physical quality of life index. Question number 89. The major contribution in amniotic fluid is by A. Fetal urine, B. Fetal plasma, C. Mother's plasma, D. Mother's urine. So major contribution of amniotic fluid is fetal urine. Question number 90. Biomedical concept of health is based on A. germ theory of disease, B. absence of pain, C. social and psychological factors, D. equilibrium between man and environment. So biomedical concept of health is based on germ theory of disease. Question number 91. The type of play a toddler is engaged in: A. solitary play, B. cooperative play, C. parallel play, D. group play. The toddler is engaged in parallel play. A high-pitched cry is seen in A. hunger, B. anger, C. maternal deprivation, D. intracranial tension. High-pitched shrill cry is seen in increased intracranial tension. হাইড্রোকেফালাসে ইনক্রিজ ইন্ট্রাক্রেনিয়াল টেনশন থাকে এবং এটা একটা সিমটমস হচ্ছে হাইড্রোকেফালাস বেবিদের হাই পিচড শিল ক্রাই থাকবে। কোয়েশ্চেন নাম্বার 93. Which of the following is a sign or symptoms of a hemolytic reaction to blood transfusion? Option A. hemoglobinuria, option B. chest pain, option C. urticaria, option D. distended neck vein. So question number 93 এর correct answer হলো option C. urticaria. Question number 94. Two blood vessels most commonly used for total parenteral infusion are the A. subclavian and jugular vein, B. brachial and subclavian vein, C. femoral and subclavian vein, D. brachial and femoral vein. Question number 94 এর correct answer হলো option A. Question number 95. A patient who refuses to take bath stating that water and soap are poisoned is a typical example of option A. suicidal ideation, option B. delusion, option C. negativism, option D. hallucination. Question number 95 এর correct answer হলো B. delusion. Question number 96. 50% glucose and regular insulin is used for the management of hyperkalemia because it option A. stabilizes the irritability of cardiac muscle, B. improve metabolic acidosis, C. transport potassium ion from extracellular to intracellular compartment, D. binds the potassium ion for excretion in the feces. So question number 96 এর correct answer হলো option C. Question number 97. Lifespan of fetal RBC. Option A 50 days, option B 80 days, option C 100 days, option D 120 days. So lifespan of fetal RBC is 80 ডেজ। কোনো কোনো বইয়ে 90 ডেজও দেওয়া আছে, কিন্তু যেহেতু এখানে অপশানে 80 ডেজ আছে, কারেক্ট আনসার 80 ডেজই হবে। কোশ্চেন নাম্বার 98, early breast cancer detection in asymptomatic individuals above 40 years of age include option A, clinical breast examination by health professional every 3-year interval, option B, annual mammogram, option C, annual pap test, option D, endometrial biopsy. So question number 98 এর কারেক্ট আনসার হলো B, annual mammogram. Question number 99, by which the effectiveness of nurse-client communication is best validated? Option A, client feedback, option B, medical assessment, option C, health team conference, option D, client's physiologic adaptations. Question number 99 এর কারেক্ট আনসার হলো option A, client feedback. Question number 100, unconscious defense mechanism in which the person undergoes a partial or total return to earlier patterns of adaptation is known as A, regression, B, repression, C, reaction formation, D, perception. So question number 100 এর কারেক্ট আনসার হলো A, regression. আজকের কোয়েশ্চেন এখানেই শেষ। থ্যাংক ইউ সাথে থাকার জন্য। আর পরবর্তী কোয়েশ্চেনগুলো পাওয়ার জন্য প্লিজ চ্যানেলটিকে সাবস্ক্রাইব করবেন। ধন্যবাদ।